My special presentation topic is Poverty Leads to Child Obesity in America by Joanna Avila, Soc. 354. Why is this topic important? This topic is important because child obesity is highly influenced by their family and community environments. Low socioeconomic status creates barriers for these families and children from engaging in healthy lifestyles. I argue that children who come from a low socioeconomic status links them to a higher chance of becoming overweight or obese in the following ways. 1. Food deserts. Food deserts increase rates of obesity because of limited food access. 2. Cost of food. Cost of food has economic constraints that lead to poor diet. 3. Parenting influences. Parenting influences such as knowledge about maintaining healthy lifestyles or maternal education have a big impact in child obesity. Child obesity facts and statistics. A National Health and Nutrition Examination survey completed by the National Center for Health Statistics from 2003 to 2004 indicated that 18.8% of children aged 6 through 11 in the United States are overweight, as compared with 11.3% in 1988 through 94. Life expectancy may be shortened by 2 to 5 years because of obesity. Children who are obese or overweight have a higher chance of becoming obese as adults. This data was taken from Schaff, Jensen, and Hinrich in 2009. Food desert. According to Wright et al., a food desert is low-income neighborhoods that lack healthy and affordable food. So there was a study conducted by Schaff, Jensen, and Hinrich in Pennsylvania, and they studied like the food desert and overweight school children. So their sample was 243 rural school districts in Pennsylvania. They gathered BMI data and, well, actually, they gathered BMI data from the Department of Health. Uh, so they also took in zip codes, latitude and longitude data as well to measure the food desert areas. So the results of this study, taking this from the statement of the article, is that the percentage of people living below the poverty line was 12.76% in food desert school districts. Adding to that, uh, food desert districts showed higher percentages of overweight students, and socioeconomic factors and family income was a strong predictor of districts' population residing with food desert. Cost of food. Caitlin Daniel conducted a study called The True Cost of Healthy Eating. She states in her article that children's taste preferences shapes low-income families and food decisions. Using 80 interviews and 41 grocery shopping observations with 73 primary caregivers in the Boston area in 2013 to 2015. Many of her research was qualitative research, and the majority of the sample is low income. In her results, she found that families with low income are more likely to purchase foods that are preferable to their children and shapes food decisions. Many low-income families purchase these types of foods for their children was because they wanted to reduce the amount of waste. Most families with low SES incomes usually receive SNAP benefits, and because of that, they get a certain amount and they have to make that whole amount stretch for a whole month. So because of that, they have to make sure that they buy food that could last them maybe a whole month, maybe a couple weeks, depending on what they want. So that way it doesn't rot out and that way they don't have to throw it away. For example, Daniel conducted a couple of interviews. One was with a woman and her two children. She states that I get my food stamps on the 5th and I try to make them last for a month. But that's really difficult because toddlers waste a lot of food. Trying to get him to eat vegetables or anything like that is really hard. I just get stuff that he likes, which isn't always the best stuff. But because of these decisions, many children in low SES families end up either being overweight or obese because of the um, high calorie foods that they consume. In contrast to families with high socioeconomic status, they are more likely to buy foods children dislike or refuse to eat, and they withstand the cost of uneaten food. Parental influence. Parental influence has a big factor, well, plays a big factor in obesity for their children. For example, there was a study conducted, Barriers to Childhood Obesity Prevention, by Vittrup and McClure. Of participants, a total of 205 parents or primary caregivers participated in this study. So they ranged about the ages 19 to 64. Parents with more than one child were asked to answer survey questions about one child who was between 3 and 10 years of age. So participants were recruited from preschools and Head Start centers in the southwestern United States. Parents had to answer a series of questions about attitudes towards prevention and intervention, knowledge about health and obesity, child's health, demographic information of both parent and child, such as height and weight. The results indicated that 164 parent and children were living at or below the poverty line. 69% were deemed to be overweight or obese. And 172 children whose parents reported their height and weight, 40% were overweight or obese. All parents of overweight children and 75% of obese children incorrectly assumed their child was not overweight. The parent weight status did not influence support ratings. Socioeconomic status actually had a big influence, especially like on the parental knowledge. When they were asked what was a major barrier to prevent childhood obesity, a lot of them did say that it was the cost of healthy foods, and others confessed that parents setting bad examples in terms of eating and exercise. Many low SES parents had limited parental knowledge when it came to like the type of exercises their kids should be participating in, or just conducting at home, or how much they should be eating, like for example, like how many cups of vegetables, or like in the my food plate, I know they say that like the amount of meat is the size of your fist that you should be eating, and how many times their children should be active throughout the week. Maternal education can also be linked to child obesity risk. A sample conducted by Prickett and Augustine in 2016 was the Early Childhood Longitudinal Study. It's nationally representative sample of children born in the United States in 2001, and the data collected on ages 9 months to 4 and 5, and the sample began with the full sample of mothers participating. So 5,000 mothers were sampled. The measurements of this study was the maternal parenting investments, such as watching TV, so the amount of television, physical health, also car safety, and eating dinner together. Prickett and Augustine indicated in their results that mothers with higher education were socioeconomically advantaged compared to mothers with less education. Um, they were older and had consistent health insurance for their child. Mothers with less education often have to work jobs that uh, are low pay, and because of this, those jobs sometimes require that they have to work long hours, so they have to be away from their families or their children because they have to earn some type of income to support them. So this means less time involved with children when it comes to dinner time or physical activity or television watching. So their mothers are not always there to like restrict it, and in turn can lead their children to obesity risk. What does the media say about child obesity? CNN pulled this map from the National Survey of Children's Health, and it analyzed the national health data on children in all 50 states between 2016 and 2017. So this map here has the obesity rates for children ages 10 to 17. As you can see here, Mississippi has the highest rate of child obesity at 26.1. In contrast, Utah actually has the lowest rate of 8.7%. CNN also gathered a statement from Marlene Schwartz, a professor and director of Rudd Center for Food Policy and Obesity at the University of Connecticut. She states that she thinks that part of it may be economic. States with higher levels of poverty may have higher rates of obesity, and that can be tracked back to the fact that it's difficult to eat a healthy diet with limited income. So she also adds that the food system makes it difficult for families to buy healthier foods. Another article relating to child obesity was taken from the Washington Post. And in this article, they say that the new federal guidelines stress that any type of amount and any type of exercise helps a child's health, and that kids need to be active as young as age 3. Children need to be participating in exercise or any type of play at least an hour a day, aerobics, sports, just anything that gets them moving. This can enhance muscle and bone strength for them. Not only that, but it can also lead to healthier lifestyles as they grow older. Um, and here I've taken a statement from the Washington Post that only 20% of Americans get enough exercise now, and that childhood obesity problem has prompted the push to aim younger, so to prevent poor health later in life. So putting it all together into analysis, it seems that media sources seem to agree that there is a link of obesity and low socioeconomic status. Going back to the CNN slide and the map did display all the different states color coded, explaining the different rates of child obesity within each state. It went from like the highest rate of child obesity to like the lowest rate of um, again, child obesity. Even, Schwartz, the professor from University of Connecticut, she was talking about that economic states with higher levels of poverty and that they have higher rates of obesity. So this can make it difficult for families with little income to afford healthier foods. Moving along to the Washington Post, they talk about that kids need to be active as young as 3 years old. Even just moving around like an hour, maybe a couple hours throughout the day, or just, a few times like throughout the week, that could really push them to fight child obesity. But then again, it needs to be taken into account that socioeconomic status, because children who pretty much like, are part of that low socioeconomic status um, where they live is sometimes very hard because these neighborhoods are full of crime, and sometimes parents don't want to let their children out because they don't want to expose them to that type of environment. um, Adding to that, parents are working to provide for their families, and it often restricts them from spending more time with their children. So I think some parents really do want to be involved, but it really just depends on like their work, and working those long hours for so little pay. But that concludes my presentation. So thank you so much for listening, and have a great day.